Lynchburg Fire Department has put together this instructional video on how to properly don and doff all of the personal protective equipment essential for taking care of patients with suspected COVID-19. The necessary components of PPE are a gown, N95 or higher level respirator mask, eye protection covering the front and sides of the eyes, and gloves. There will be times when it is acceptable to reuse the same N95 mask. If the firefighter has had little or no interaction with a suspected COVID-19 patient, a mask can be used again. For example, if the firefighter entered the same room but did not come within 6 feet of the patient and did not perform any patient care, then that provider can wear that mask again. Any firefighter that does provide patient care or rides in the back of a medic unit to the hospital with a suspected COVID-19 patient should discard their mask, gown, and gloves and decontaminate their safety glasses. First, put on the gown, being sure to fasten all of the ties. Always keep your portable radio underneath the gown. Put on the mask and check for proper fit. Cup both hands over the front of the mask and inhale sharply. A negative pressure should be felt inside the mask. Put on your eye protection, then gloves. Make sure to place the gloves over the cuffs of the gown. When doffing your PPE, be careful not to expose the skin or uniform to contaminated items. Place a biohazard bag on the ground in front of you. Carefully take off your gloves in the normal inside-out method. Remove the gown by pulling from the top, ripping it out and away from your body while rolling it up. Put on another pair of gloves. Remove the goggles and wipe them off with a cavi wipe or spray with a disinfecting spray. Use the same cavi wipe to wipe off your gloves or replace your gloves with a brand new set. Remove your mask slowly and place it in the bag. Then remove your gloves. Sanitize or thoroughly wash your hands as soon as possible. Do not touch your face until this can be done effectively. Place the biohazard bag in an exterior compartment of the medic unit. Driver. When assigned to drive a medic unit to the hospital, you want to be sure to limit contaminated PPE while inside the driver compartment. Doff your gloves and gown and place them in the bio bag. Keep on your mask and eye protection while driving to the hospital. Once you arrive, return to your PPE compartment on the exterior of the medic unit. Place on a new gown and gloves. Once patient care has been transferred to the ER, keep all PPE on to return to the medic unit to clean and decon the stretcher and patient compartment. Be sure to keep the doors open while cleaning to allow for sufficient air exchange. Continue wearing your PPE to prevent any splashes or sprays to your face or skin. Use the same method for doffing PPE after cleaning. This concludes our instructional video. Thank you for your time and your hard work. You are so very much appreciated.